Those insurers are not only bracing for reimbursement cuts and other changes in the Affordable Care Act, but also some tough new competition. Tonight, we begin a three-part series on the changing healthcare insurance business. We begin with a look at how some hospitals are now offering their own healthcare plans. Bertha Coombs reports.
We're targeting that dimension right in between the vanity and the medicine cabinet.
Mike Pervalaris doesn't have to offer his workers health benefits, but he always has.
We target people that are stable, family people who expect at this point, that the insurance is going to be taken care of by their employer.
This year, the Long Island small business owner is gambling on a brand new insurance company tied to a big area hospital, North Shore LIJ. Its rates were lower, and his staff is happy with the choice.
The people that accept this insurance seem to be the doctors that they already had, so it seemed natural.
The CEO of North Shore LIJ's new Care Connect insurance unit says the hospital's name recognition has helped them compete with large insurers on New York's exchange and in the private market.
We are not a United Healthcare. We are not an Empire Blue Cross Blue Shield. We have a very narrow network, but it's a highly intense, interactive network. So what you trade in choice, we hope you make up with in simplicity.
It means Care Connect will reimburse North Shore differently than other insurers.
I don't necessarily reimburse them on a fee-for-service environment. What I do is I agree ahead of time that I will spend X number of dollars on healthcare. And it's up to them to work with us to figure out the most efficient and best place for that healthcare to take place so that they're not trying to fight for every penny.
If they get it right, they'll join the ranks of Kaiser's health system in California and Geisinger in Pennsylvania, highly regarded hospital systems which hold down costs by integrating coverage and health care.
So do you want anything for pain now?
Hospital systems first got into the business of insurance back in the 90s when HMOs were popular, but many of them found they couldn't make the financials work. Analysts say this time could be different.
Since we've moved through the 2000s and into the current day, the data capabilities are much greater. And many hospitals are much more closely aligned with their physicians.
Moody's Lisa Martin says having an insurance plan can help hospitals keep patients within their systems as long as they don't alienate other payers.
The other risk for a hospital running a health plan is really managing the relationship with the insurers that now the hospital is directly competing with in its own market.
So far, Care Connect has exceeded its enrollment expectations.
We thought that we would probably have about 3,000 to 4,000 individual members, of which, let's say 50 to 60% of them would actually pay the bill. We've had almost double that, both on and off the exchange.
Mike Pervalaris is hoping it pays to be one of their first members.
We try new things every day. We're business owners. So we have to be a little bit daring sometimes to make good decisions.
Bertha Coombs, Nightly Business Report, Long Island, New York.